This conference will now be recorded.
All right, we're going to start now. Good morning, everyone. My name is Dr. Bhavna Sharma. I work as a medical registrar in the NHS, and I am going to be starting my super specialization in endocrine in August. Today's session is going to be on specialist referrals, which appear on your OET writing. We'll try and focus on two particular things, which will be your surgical referrals. So that's for the doctors in our session. We're going to be covering the surgical patients. So you'll have a patient who's coming in with particular complaints. You've diagnosed a surgical problem in them. You think that they need a particular surgery, and now you're writing a letter to a surgeon. Remember, nurses who've joined us as well, all of the techniques that I give out are applicable to both doctors and nurses. So the sentences will remain the same. It's only the audience which will change. So make sure that you pay full attention during the course of this session. Now, a concept which I have discussed in my previous sessions as well is the concept of audience awareness. So the main point on your OET writing is whether you're aware of who you're writing this letter to. You need to know who your target audience is. So when you're writing your letter, or when you start preparing for your letter, you get about 5 minutes just to prepare. During that 5 minutes, I advise you to first start out with thinking about 3 points. First, what your role is. Second is who you're writing this letter to, and why are you writing this letter. And the third thing is that do they already know the patient? Okay, so sometimes you might have a patient that you've seen for a short time, and now you're referring this patient back to their original person. So that's not actually a referral letter, that's a discharge letter. So what that means is you are a specialist, or you are someone who's seen this patient for a very short period of time. You've made some small changes or large changes in a brief period of time in regards to this patient's treatment, and now this patient is going back to the person who already has been taking care of this patient for a long period of time. So that's your discharge letter. A transfer letter is when you were a regular carer for a patient. So you were the regular doctor or the regular nurse for this patient, and now this patient is not going to be your patient anymore. They're going to another person or another practice who's going to be their new long-term carer. Okay, so you're transferring that patient to someone else. Now, a referral letter is when you are the regular carer for a patient, and this patient is going to another nurse or doctor or practice for a particular issue that they might have. Now, this particular issue might be a new diagnosis. It might be certain things which you aren't able to completely take care of. Maybe it's pain related to cancer. Maybe it's someone who's dying and needs palliative care input. So you've been taking care of this patient for a long period of time. They've been diagnosed with cancer and they're dying. So you're referring this patient to a specialized palliative care nurse so that they can contribute to this patient's care. You might not be able to provide the full care to this patient, and that's why you're asking the assistance of someone else to help you out. Okay, so the first person which crops up quite a lot on your OET writing is a surgeon. Now you can see a sample letter that we used in our mocks, in our writing task this week. If this is actually this is a letter which someone is supposed to write a letter to a neurosurgeon, and this patient has come in with certain complaints, and you want you as a GP want to, or as a medical ward doctor, want to refer this patient to a neurosurgeon in another hospital. So what I want everyone to do is, please tell me what kind of a letter this is. Is it a referral letter? Is it a transfer letter? Is it a discharge letter? You can probably see the answer on your screen, so you can cheat a little bit. And what I want you to do is, keeping in mind that this is a referral to a neurosurgeon, so it's a surgical referral, I want you to tell me which is the history that you're not going to include in a letter to a neurosurgeon. So we're going to be including, so everyone said it's a transfer letter, so that's good. Shamim has actually said it's an urgent transfer letter. So Shamim, you're very, very right. Now what I want everyone to do is to tell me what is the history which will be irrelevant when you're writing this letter to a neurosurgeon. All right. So Dr. Aradhna has said that she won't include the history for social background. Okay. What else? Shamim has said he would not include the history of a radial fracture, and Mariam has said the same. Okay, that's good. Anything else you would not like to include? So Sony has said he would not include allergy to morphine. So Sony, I would advise, when you're writing a letter to a surgeon, now the surgeon is going to conduct a surgery on this patient, and during the course of surgery you have to use a lot of medications which may sometimes include morphine or morphine-like compounds. Okay, so even though this is an English exam, this is not a medical exam, in any situation except when you're writing a letter to someone who's non-medical and is not going to prescribe any medications to your patient, always include allergies. Now, you don't need to include allergies to if you're writing a letter to a social worker, because the social worker isn't going to administer morphine to your patient. So in any letter to any medical professional, include allergies. Shruti has said she won't include the history of appendicectomy. Shruti, this is a surgeon that you're writing a letter to. As a broad rule, if you're writing a letter to a surgeon, include previous surgical history. Again, I keep repeating it and I become like a parrot. This is a English exam. This is not a medical exam. Even then, as a broad rule, surgeon include surgical history, because the surgeon needs to know whether this patient underwent anesthesia before, whether they were put under sedation, whether they had any post-surgical complications, because they're going to be doing a surgery on this patient. So they need to know about previous surgery. All right. Now, what I'm going to do is I'm going to give you a format which I would use if I'm writing a letter to a surgeon. So If I'm working as a medical registrar and I'm working in, for example, acute medicine in the A&E, or if I'm working as a doctor in accident and emergency, if I've got a patient who I want to refer to a surgeon, I would keep in mind certain things that a surgeon needs to know. Now, just remember that your referrals can either be your general surgical referrals or specialist surgical referrals. Now, what a general surgeon is, that's someone who's going to do the basic things, like they're going to do appendicectomies or basic GI surgeries or things like hernia operation. So that will go to a general surgeon. Now, a specialist surgical referral will be to people who just specialize, for example, in gastrointestinal surgeries or neurosurgeries like this case. So in both of the cases, you include your past surgical history. But before doing anything, ask yourself, you get your task in front of you, okay? Now when you get your task in front of you, go to your task, you identify who your audience is. You identified your audience in the previous case as a neurosurgeon. Now before doing anything else, make a hypothesis as to what would a neurosurgeon want to know in order to conduct the surgery. Okay, so what they're going to need to know is what was the history, what were the examination, and what was the investigations which made you think about the provisional diagnosis of this patient. Okay, now in the previous case, if I go back to the previous case, this was a patient that I thought, or the person writing this letter thought, might have had a subarachnoid hemorrhage. Now, the only thing that the neurosurgeon wants to know is to why do you think this is a subarachnoid hemorrhage? So, in the history, you're going to include the things which made you think, okay, this might be a subarachnoid hemorrhage or this might be a problem in the brain. In the examination, you include the positive points which made you think that this might be a subarachnoid hemorrhage. Broad rule, you include surgical history and allergies. Social background won't really contribute to your provisional diagnosis, so I would say plus minus. But one thing which I find on the social background, which is very, very significant and a little bit unusual, is the 50 pack year history of smoking. Now that's a very large history of smoking. So anything which strikes you as particularly unusual, which is a large pack year history or a long history of using alcohol, that would be significant. So I would include that. Now, this is an English exam. This is not a medical exam. I keep on repeating that. But if you think about it, one of the risk factors of getting things like a brain problem or a brain bleed can include smoking. But if you don't want to think too much medical, if anything in the social history strikes you as abnormal, like a very bad alcohol history or a very bad smoking history or a significant history of IV drug use, that you should include. Okay. But the surgeon or the neurosurgeon only wants to know what led you to make that diagnosis. So you do that. So I'm going to include that this patient came to me complaining of thunderclap headache radiating to the neck associated with neck stiffness, with no history of photophobia. He also had multiple episodes of non-blood-stained, non-bilious vomiting. His pain wasn't relieved by paracetamol. His GCS was 14 out of 15 as he was slightly drowsy. His he does have a history of previous appendicectomy, 1998. He is an active smoker with a smoking history of 50 pack years. When a CT scan was done on this patient, It revealed extensive subarachnoid hemorrhage filling in the basal cistern. He was started on IV fentanyl. Okay, so all of the events which made me think about this history, which made me think about this provisional diagnosis of subarachnoid hemorrhage will be included. Okay, so you tell story that this patient came to me with this. He had these findings, so we did this investigation. Now from everything that we've got, I think this patient has a subarachnoid hemorrhage. That is why I am referring this patient to you. So Chandar has said history of trauma is important. So Chandar, history of trauma will be important if the patient had trauma immediately preceding your complaints. Okay, if it's a negative history of trauma, it doesn't really matter. Again, this is an English exam. This is not a medical exam. But if there are particular things which strike you as to being pertinent, if you include them, but you do not include things which are obviously wrong, then you will not get penalized. Even if you include, there was no history of preceding trauma or fall, you would not fail your OET writing. You would, however, fail if you use a wrong tense while saying that. If you say that he has not been having a history of trauma, that's going to make you fail. If you say there was no history of preceding trauma or fall, then you will pass. So if you're thinking too much and you still want to include some things which you think might be medically right, then include them, but make sure that when you include them, your English is correct. Okay, now, but the basic gist of everything is when you're writing to a specialist with a provisional diagnosis, you're going to tell a story. So all the positive examination points and all the positive investigations. So anything which is abnormal in your examination or in your investigations has to be included. Remember, this is a specialist that you're writing a letter to. You are not the specialist. So you are always making a provisional diagnosis. Your diagnosis is never a final diagnosis. You cannot tell a surgeon that this patient has appendicitis, do an appendectomy on this patient. You have to be respectful. So a portion of OET writing is whether you are professional in your language. So you have to be respectful to the surgeon's background knowledge. So you have to tell them that this is a provisional diagnosis. This is not a final diagnosis. And how do you do that? That's what we're going to do, a cheat sheet. All right, just a few points which I've seen people making mistakes in our mocks that we conducted this week. When you're talking about vitals, usually you should use the present tense because the vitals were true to the time where you were writing this letter. So when you were writing this letter, the vitals were happening. So the blood pressure was this, or the heart rate was this. Okay. Now you might modify this. Sentence a little, make it a little more complex by saying that at the time of assessment, Mr. or Miss Dash, whatever your patient's name is, had a heart rate of this and a fever with temperature this. So this you're only going to include if they are abnormal. So try and waste as less time of the specialist as possible. Only tell them things which you think are significant. Another way, At the time of writing this letter, Mr. or Miss had a heart rate of dash and a fever with temperature that. Or the thing which is most commonly used when you're telling someone about a patient's vitals is at present, Mr. or Miss Dash has a heart rate of dash and a fever with a temperature of dash. So you can take a screenshot of this. These are two alternatives that you can use when you're telling the specialist about a patient's vitals. Once you've done that, please type in yes, and then we can move on to our next cheat sheet section. All right. Excellent. Now we're going to move on to the next slide, which will be your examination findings. Guys, again, you include the examination which made you think about the diagnosis. So on examination, Mr. or Miss Smith was found to have dash. Now notice the first sentence and second sentence, they vary a little. In the first sentence I've written was found to have a, and on the second sentence I've written was noted to have dash. Now what I want you to tell me when you would use the first sentence and when you would use the second sentence.
ये इनकी अपनी के दराज से ना बाकी के 50 निकाल लेना.
Okay, so slightly difficult question. Mariam has said that when you observe a sign, you write with a. So, Aruna, remember we're talking about examination findings. So, on examination, Mr. or Miss Smith was found to have a lump in her tummy. Was found to have a tender abdomen. Okay. Second sentence, on examination, Mr. or Miss Smith was found to have tenderness in her abdomen. So the first sentence was found to have a tender abdomen, and the second sentence is was noted to have tenderness in her abdomen. Okay. So guys, if you understand the difference between where you use a, so that would be a tender abdomen, a lump in the tummy, or a lump in the abdomen. On examination, Mr. Miss Smith was noted to have tenderness in her abdomen. Do you understand the difference between that? Why we're using a and why we're not using a? Just type in yes if you understand the difference, or I'll try and explain it further. Excellent. Now, guys, these might seem to be very, very subtle things that you might think, why am I telling you about this? But these are things that the OET examiners are looking for, and they want you to make this mistake so that you can get your marks cut. So what I advise you is try and pay attention to these subtle things about how you give out examination findings. Hopefully, After this, none of my students will make a mistake where they're using a and where they're not using a, especially when they're talking about examination findings. Next thing, what I've already alluded to is when you're talking about provisional diagnosis. So provisional diagnosis, anytime you refer to a specialist, you never give out the final diagnosis. The final diagnosis is something that the specialist is going to do. So, three ways where we can write our provisional diagnosis. So that's your cheat sheet for provisional diagnosis. A very good example. In view of the above history, examination, and investigations, we believe, or I believe, that Mr. Smith might have a subarachnoid hemorrhage. We are therefore referring Mr. or Miss Smith to you for your esteemed specialist care. Or you can write, in view of the above, comma, we opine that Mr. or Miss Smith might have had a subarachnoid hemorrhage. We therefore wish to urgently refer Mr. or Miss Smith into your esteemed surgical care. In keeping with the above positive findings, we opine that Mr. or Miss Smith might have a provisional diagnosis of, or you can write, might have a possible diagnosis of a subarachnoid hemorrhage. She or he would benefit highly from your specialist care. So remember, when you're talking about things that the person can get at multiple times in their life. So you can get a heart attack multiple times. So when you're writing about that they might have a heart attack because it's a single episode of heart attack that they've had. Now there are some things that you can get only once in your life. For example, things which last like diabetes, hypertension, multiple sclerosis, some kind of a cancer. For example, I mean, you can get cancer a number of times in your life, but it's usually very, very rare. So if you're writing about things that you're going to get multiple times in your life, for example, a subarachnoid hemorrhage, a subdural bleed, an accident, a radial fracture. So that's going to be preceded by a or an. If you're talking about things that they can get only once in their life, we opine that Miss Smith might have a provisional diagnosis of multiple sclerosis. It's not going to be a multiple sclerosis, it's going to be just multiple sclerosis. Or might have a provisional diagnosis of diabetes mellitus. It's only going to be diabetes mellitus. It's not going to be a diabetes mellitus. So guys, make sure that you understand these are the mistakes which we make commonly when we're writing medical letters. So we're trying to correct them now. So if you've understood the difference as to where you would use a when you're writing a provisional diagnosis versus where you won't use a or an, please type in yes and then we can move on. Said we or I both can be used. So Fasiha, what I advise you to do, if you are, for example, if you're a GP and you're working alone in your practice, then I would advise you to write I. But if you're a medical registrar who's a part of a hospital and you're writing this letter on the behalf of your team, you should write we. So Kares has said multiple times diseases, not use a or an. So Kares, if you can get a disease or you can get a medical condition multiple times in your life, then you write a. So a heart attack, a headache, a subarachnoid hemorrhage, because you can get them multiple times. If there's a disease which is going to be a chronic disease and it's going to last, then you don't write a or an. So they have a diagnosis of multiple sclerosis. They have a diagnosis of diabetes mellitus. They have a diagnosis of a subarachnoid hemorrhage. Okay. All right. So Sony has said, we've written the purpose in the intro. Do we have to repeat it at the end? So Sony, if you're writing a surgical letter, a good strategy that you can have is you start out with thanking them for seeing your patient and telling them that you want to refer this patient to them for their specialist opinion. And at the last thing, you can, then what you do, you've done that, you refer them for the specialist opinion, then you give out your story. And then once you've told them the story, then you tell them, keeping in view of the above history and examination, we believe that Miss Johnson might have a provisional diagnosis of subarachnoid hemorrhage. Therefore, I am referring this patient to your specialist care for consideration of coiling or clipping. So in your last sentence, you tell them about your provisional diagnosis and you tell them about a particular surgery that you think the patient might use. Tabuya has said, if you're a nurse, do you use I or we? Tabuya, again, that depends upon what your role is. If you are a district nurse or you are a community health nurse and you're the only one seeing this patient, then you use I. If you are a part of a hospital team or you're part of a practice and you're referring this patient on the behalf of your team, you should write we. Okay. So some good points which we can use on our surgical letters. So now what we're going to do is we're going to move on to our specialist nurses. Now, the specialist nurse scenario appears for both doctors as well as nurses. So basically, if you don't understand the concept, I've covered this before in my previous session on the types of letter on your OET. So if you go to our YouTube channel, if you type in Teachio Academy on YouTube, you should be able to find a series of our previous lectures as well as some role plays that we've done with NHS doctors and nurses. I've tried to cover this in our previous sessions as well as to what is a specialist nurse, but I'll try and reiterate that now as well. Now, in the UK or in Australia, where this OET exam is designed, you've got someone who is a specialist nurse. So specialist nurse is basically someone who's completed a nursing degree and then they've specialized in a particular disease or a particular aspect of nursing. Now, aspects of nursing, the most popular type to appear on your OET writing are your tissue viability nurses. So tissue viability nurses are basically nurses who deal with chronic wounds and chronic ulcers or things which might be causing so basically the term tissue viability means maintaining the integrity of your skin. So any chronic wounds or any chronic ulcers or any chronic bed sores are going to be managed by a tissue viability nurse. I'll discuss this in detail as when we're writing a letter to a tissue viability nurse, but I'm just trying to explain the concept as to what a specialist nurse is. So that's basically someone who has a nursing degree and they've got something additional and they're very, very specialized in a particular field or a particular disease. Similarly, a cardiac rehab nurse is someone who's just going to specialize in cardiac rehab. Notice I have two types of nurses in bold, which are your practice nurse and your community health nurse. We'll discuss at the end of our lecture as to how referral letters or transfer letters vary for these nurses. So just keep a hold on. This might be a special type of nurse that we need to pay attention to. All right. Now, when you're writing a letter to a tissue viability nurse, this has appeared a lot on your previous OET exams. So pay attention to this, doctors as well as nurses. So in a tissue viability nurse letter, you'll basically have a patient who's got a chronic wound. They'll give you some dimensions about the wound. They might tell you what the wound looks like. They might talk about in the past medical history about some risk factors which made the patient susceptible to getting that wound. And then they'll talk about treatments that you tried as a doctor or a nurse. And then you're making a referral letter to the tissue viability nurse. So you can divide your letter to the tissue viability nurse into 4 sections. So in the first section, you're going to first introduce yourself. You're going to thank the specialist nurse for their expert opinion because you're a very polite doctor, polite nurse. Then when you start talking about your wound or the patient's wound, you're going to write, Mr. or Miss Smith currently has a deep necrotic ulcer, or whatever description is given about your ulcer, you just insert that. But the grammar that you're using is currently has a. So when you're writing that letter, the ulcer is there, so it is has a. Remember, because you're talking about a third person, this is not have a, this is has a. Okay, has a deep necrotic ulcer, whatever the description of that wound is, over his or her foot. So because this is a wound which is present on the skin, that's why you write over his or her. You don't write in, you don't write at. You can write on his or her foot. Okay, over his or her foot or on his or her foot. But just pay attention to the grammar that we're using and the prepositions that we're employing when we're writing about a chronic wound. So they're looking for you to make this mistake, but now that you have the cheat sheet, you should be able to solve that. Then you talk about the past medical history. Often chronic wounds are caused by uncontrolled diabetes, and that's what appears on your OET writing. How do you write that? Mr. or Mrs. Smith has a past medical history of diabetes mellitus, which may be adversely affecting his or her wound healing. So just in the past medical history, you can enter diabetes mellitus and your sentence is correct. Now, a modification of this. This patient might have had a fall, and that's why they got a chronic wound. So you can write, Mr. or Miss Smith has had a fall in yesterday, or has had a fall last month. So remember, we're putting a for things that people can get at multiple points in their life. So your fourth paragraph is just Mr. Miss Smith has been treated with whatever treatments you've given this patient. And then you write, Mr. or Miss Smith would need your urgent assessment and possible treatment with regards to his or her chronic wound. So anyone who's writing a letter to a tissue viability nurse, if you divide your letter into these sections, you should be able to sort it out. eBay asked that question as to when we have someone with multiple visits. So eBay, if you've got someone who you had multiple visits with regards to their tissue, with regards to an ulcer that they had on their foot, you're going to be talking about the first visit, the second visit, the last, sorry, not the second visit, the last visit, and in between you can put in all of this. Okay, so that would sort out your letter into a specific format. Now, a cardiac rehab nurse. So we've already discussed a cardiac rehab nurse is someone, when someone has a heart attack or they have heart failure, they get referred to a cardiac rehab nurse. Now, the cardiac rehab nurse specializes in providing the patient lifestyle help. So they're going to help with making this patient exercise. They're going to help with this patient manage their diet. They're going to help this patient manage their stress. They're going to help this patient with their smoking or alcohol, because everything which makes a heart problem worse in terms of non-medical things are going to be managed by a cardiac rehab nurse. So mostly when you have on your OET exams, you have someone who you're supposed to refer to a cardiac rehab nurse. You've got someone who's either had a heart attack recently or has been admitted to the hospital with worsening angina or worsening heart failure. So in the first line, you write about why you're writing this letter in terms of what the patient has come to you with. So you can write, Mr. or Miss Smith has had a recent hospital admission with worsening heart failure, or Mr. or Miss Smith has had a heart attack recently. So the thing has already happened. So that's why you're writing has had a heart attack, not had a heart attack. You don't write has a heart attack. You write has had a heart attack. Mr. or Mrs. Smith has had a heart attack, and that's why he needs your help or she needs your help. Remember, just pay focus onto the grammar and the tenses that we're using. The purpose of the cheat sheet is to give you out sentences in proper tenses, which you can cut, copy, paste on your OET writing. If you make a single mistake in this, the sentence will become incorrect. So I would advise taking a screenshot of this and memorizing these sentences. He or she is being referred to cardiac rehab for his or her ongoing needs. So this sentence can be used with everyone, even if you've got a surgeon, even if you've got a palliative care nurse, even if you've got a tissue viability nurse, you can cut, copy, paste this sentence that she's being referred to you or referred to your practice or referred to your service for his or her ongoing needs. Now, everyone who's being referred to a cardiac rehab nurse is going to have some risk factors that the cardiac rehab nurse needs to know about. So you write, in terms of cardiac risk factors, comma, Mr. Smith has a sedentary lifestyle. Okay, so there'd be someone who doesn't exercise that much, or someone who's got a very stressful life. They're not really exercising. So you write, in terms of cardiac risk factors, Ms. Smith has a sedentary. So you replace all of that about the patient not exercising, having a stressful job, not getting time for themselves with a single sentence, has a sedentary lifestyle, and the cardiac nurse knows everything about it. The same would need your help in terms of arranging a supervised exercise program. So anyone who's got a sedentary lifestyle will be referred to an exercise program. So you just write that sentence. Mr. or Miss Smith currently smokes. Okay. So at the time of the referral, Mr. or Miss Smith is still smoking. So that's why you write currently smokes 15 cigarettes per day since the past 20 years. Lots of people are making this mistake, especially when we gave out the mock on cardiac rehab nurse last week, is about pack years. If you want to write about the pack year history, you should write Mr. or Miss Smith has a 40 years pack history. Okay, not has a history of 40 pack years, has a 40 pack years history. If you're talking about alcohol, don't write abuses. I would say write consume. Okay, abuse, alcohol abuse might be a very strong word, especially for someone who's binge drinking. You don't want to sound judgmental for your patient. You write, she consumes 5 units of alcohol per day since the past 15 years. So all of these things will be common when you're writing a letter to the cardiac rehab nurse. You'll be someone who's had a heart attack and you write the first sentence. You'll be someone who smokes a lot, you write the third sentence. You've got someone with a sedentary lifestyle, you write the second sentence. So utilize all of these sentences. If you do that, you're going to score good marks on your grammar as well as your clinical communication. Now, you always conclude your letter to your nurse or to your specialist very, very respectfully. You write, we believe, or I believe, that Mr. or Miss Smith would highly benefit from follow-up at your esteemed center to optimize his or her cardiac health. So that's an excellent method of concluding a letter to your a cardiac rehab nurse. So Aradhna has asked, is this 40-year pack or 40 pack years? So Aradhna, it's 40 pack years. So because you have been the patient has been smoking 40 packs per following years. So that's why it's 40 pack years rather than 40-year pack. Okay, that's just the way a normal sentence would form, that she has been smoking 20 packs for 50 years. So that would be your 200 pack years. So it's the same format as to what a normal sentence would be if you're getting confused. Aradhna, if you've understood that, please type in yes. Then we'll just move on to our last specialist nurse, which is your palliative care nurse. Now, this happens quite a lot. Sometimes international doctors or nurses do not understand the concept of what a palliative care nurse is. So basically, if someone's got cancer, which is not curable, for example, they've got a metastatic cancer or an advanced cancer, which is not something that we can treat. So that cohort of patients is seen by, or you get assistance of, a palliative care team. Now, what the palliative care team means, palliation means optimization of uncontrollable medical symptoms or untreatable medical symptoms. So if you've got someone who's got cancer and they're dying of cancer, but the problem that you can't really cure the cancer, but the thing that you want to do for your patient is to control their pain. Okay, so that will be something that the palliative care nurse would help you with. Another example, if a patient is dying and they've got aspiration pneumonia and you don't have any treatment for them because treatments aren't really working, the patient is in a lot of discomfort, you've stopped the antibiotics, you've stopped all of the IV fluids because you think that this patient is dying very soon, but they're struggling with their breathing. The palliative care team will help you to give them medications which will help with their breathing. Mostly when this palliative care nurse or Macmillan nurse appears on your OET writing, it's in the context of someone who's got advanced cancer or metastatic cancer and they have problems managing in the community, and the problems that we have during when this patient is getting discharged is that they're going to be suffering from chronic pain, and the reason why you're referring this patient to the palliative care nurse is usually for pain or problems with assistance at home. So how would you start this? You would write, Miss Smith is being referred to your care as this gentleman or lady has ongoing palliative care needs due to his or her recent diagnosis of cancer or if it's something which has gotten worse, worsening symptoms due to known metastatic malignancy. So in the first case, it was a recent diagnosis. So you write due to his or her recent diagnosis. But if it's something that the patient has already been suffering from or already has been afflicted from, you write due to his or her worsening symptoms due to known or owing to known metastatic cancer. Everyone tells this. Why, if we can use unfortunately or fortunately. If your patient is dying of cancer, it's an unfortunate thing, so you can use unfortunately. Unfortunately, Mr. or Miss Smith has not responded to curative medical treatments. He or she would therefore need your esteemed care to optimize symptom control. Very good sentence when you're writing a letter to a nurse regarding a patient who's dying. Due to his underlying diagnosis or her underlying diagnosis, again, you can use suffer only if the patient is terminally ill. If a patient has got diabetes or they've got hypertension or they've got hypothyroidism, those are things that you can control. Those are things that you can possibly cure. So you don't use suffer. That's what the official OET site has, or the official OET has told us, that you use suffer only if the patient is dying, and unfortunately only if the patient is dying or they've got no cure. Suffers from intractable. So instead of uncontrolled pain, a very good word that you can use intractable. So intractable basically means uncontrollable. So a good word that you can use on your OET writing. This would need your specialized palliative care management. Okay. So the last line, you can also use this for people who've got chronic wounds due to underlying diagnosis. Ms. Smith suffers from intractable wound infection. This would need your specialized tissue viability care management. So Aruna is asked, do such scenarios appear on official tests, writing a letter to a nurse? Aruna, these do appear on your OET writing. Remember, this is a specialized nurse. This is not a letter to a regular nurse that we're used to. This is someone who's a specialist in that field. So learning about this in terms of writing specialist referrals becomes very important. If you've missed the previous slides, all of this is going to be uploaded on YouTube so that everyone can make maximum use of this lecture. I know it's a weekday. We haven't had people, we've lost lots of people who couldn't join in because they were on call, but I'll try and upload this today just to make sure that everyone gets to watch this lecture on time. Now, another nurse which does appear on your OET specialist referrals is the diabetes nurse. So in a diabetes nurse, you would always have to talk about how long they've had diabetes for. And mostly, if you're referring this patient to a specialist, you would have a patient who's non-compliant with your treatment. So I've made a good sentence for that. Mr. or Miss Smith was diagnosed with diabetes in 1998 or has been diagnosed with diabetes since 1998. Okay. But was diagnosed in diabetes is a little easier. Since then, he has had an unfortunate history. It's unfortunate because it's making the patient's symptoms worse. History of non-compliance with both dietary control and medications. Mr. or Miss Smith has had some complications related to his long history of diabetes. He has been diagnosed with diabetic retinopathy or any complication they've been diagnosed with. He would therefore benefit from your specialized input. And then in any diabetes case, you have to talk about medications. Has been prescribed this medication, so it's always has been, and the insulin is administered via a syringe or a syringe driver. Okay. Now, the last thing that which will be a preamble to our next lecture. What I want everyone to do before we end this session is just let me know what kind of letter this is. We'll see who responds the fastest, and then we'll talk about what our next lecture is. All right, what everyone has to do is you have to tell me what kind of letter this is. Excellent. So eBay was talking about multiple visits. Multiple visits gets very, very difficult when you're writing a transfer letter. You are the regular carer for this patient or the regular doctor or the regular nurse. Now this patient is not going to be your patient anymore. They're going to become someone else's new patient. So you need to give out as much information as possible for continued care of this patient, and you have to write this transfer letter. You can see, like eBay said, this has multiple visits in September 2017, December 2017, March 2018, October 2018, January 2019. What I'll do in the next lecture is I'll try and give out cheat sheets as to how you can organize your information into chunks when you're writing a transfer letter. So we'll do this session on Monday. I'll try and do it in the evening because I know lots of people had issues joining our lecture today. Guys, please make sure that you join us for a grammar session on active and passive voice by Mr. Manoj, who's our OET grammar expert, on Sunday. Please visit us on teachioacademy.com for our writing and speaking checks. And all of these videos are on our YouTube channel. It's by the name of Teachio Academy. So make sure that you subscribe to it. Thanks, guys, for joining us. I hope you've learned something new today and you're going to take back the knowledge from learning today into your future OET letters. And I hope you guys are keeping safe and you're going to do very well. Don't get disheartened by the things which are happening with postponing of exams. Just keep practicing for your OET. Whenever the OET happens, I'll aim for my students to pass on their first attempt so that they can be well prepared for the PLAB 2 exam when it's relaunched in 2021. All right, guys, good luck. Thanks for joining us.